This is like the mini OPD. Some of you who have been students at the college would know how we run the OPD in the college. So we're going to divide the day like this, that first, some of you are not aware of temperaments, so I'll talk in short a little about temperaments, very little. After I talk to you about that, then I will distribute to you one case, okay. The case is given to you, you go through the case, okay, make your own deductions about the case. Then after that, each of you will write your name, will write the name of the remedy, okay, and pass it on to me, and then I will ask each of you why you want to prescribe that particular remedy. First and foremost, what is temperament? Introduction to temperament. Now, when did it start? So before that is 400 BC, Hippocrates would call it blood, yellow bile, black bile and phlegm. Later on, in 149 AD, Galen started calling it sanguine, choleric, melancholic and phlegmatic. Mind you, 4 temperaments are described in medical books. The nervous is an add-on that I have done, because without the nervous we would be incomplete. They have included the nervous partly in phlegmatic but not given it completely different status, which I feel is definitely required. Next, thereafter we had Dr. Hahnemann, and along with Dr. Hahnemann, the other people who did their search was Nair, Fleury, complete repertory. Robin Murphy has given a lot of importance to temperaments, and there is another person called David Little in the recent years who has also contributed a lot on the temperaments. Okay. Now, many a times one of the reasons why we went into this study in detail also is that we find that that the person is somewhere near pulsatilla but is not a pulsatilla. Okay, and then you feel in pulsatilla nahi hai par ye nahi hai, then she is this, no, she can't be that either, and finally you just settle for a remedy. Okay, and because we settle for the remedy, you are not happy with your prescription, and if you do happen to get a cure, it's a cure which happens by fluke, you are happy that way. But multiple flukes while this will make a clinical picture in your mind, and then you will perfect yourself for that particular remedy, but that will take years. Okay, so with this what we want to do is we want to cut out the different years. Just as we have a hot and a chilly filter, and the moment you apply a hot and chilly filter, what happens? The hot remedies go off. So you know that no, hot. So nobody can dispute that. So it's hot and chilly and it's out and it's done. Similarly, what we want to do with temperaments is to understand the temperament of every patient vis-a-vis the temperament of every remedy. Okay, so this study of temperaments has been a 10-year long study of patients and of personal study also. Now what happened is, I'll explain to you a little behind. The first book that we went to was the Nair's repertory. Okay, and we went to Nair's repertory, and from Nair's repertory, in the last chapter of Constitution, etc., I took out the rubric temperament, and from there I chose all the 4-5 red letters, that means 4 marks remedies which were covered under sanguine, 4 marks choleric, 4 marks, in this way I gathered them. After putting all of them together, I tried to find the common symptoms which ran between all these. After that, the next step to that was that after I find that out, then I went on further to find out which are the other remedies which are appearing here but are not appearing in the repertory. Okay, for the same group of symptoms that are given. Then from there we went straight, we had a big jump from that straight to complete repertory. So the volume suddenly increased, and from complete repertory each rubric thereafter also was analyzed. Okay, in between that whatever I got, I tried to correlate with the materia medica of each remedy, and not from one but from as many authors as we possibly could. Then as a next step after that, what we did is we incorporated complete repertory, and each rubric that is there, each rubric was termed. For example, if you have a rubric, say impatient, okay. Now impatient is a rubric which is markedly choleric, but hurried is a rubric which is markedly nervous. Careless is a rubric which is markedly, tell me what? Phlegmatic. But the moment from careless I would go to heedless or reckless, it goes to sanguine. Okay, so in this way one will change. You will have a person who is obstinate. Who is obstinate of the temperaments? Who's obstinate? Who's obstinate? Phlegmatic. Okay, what is obstinacy? Obstinacy is pig-headedness. Okay, it is nothing else but pig-headedness. Okay, you will call a small child as being very, very obstinate. But when the form obstinate, you start going towards stubborn, you walk towards the choleric. And from the stubborn, when you go towards headstrong, it becomes further markedly choleric. So this is little interplay of words. You get my point? Step 1, step 2, step 3. Okay, so if you are able to understand the patient like this at different grades, then you will be able to understand. Now very often what happens is that we do not know the exact meaning of obstinate. What is the difference between obstinate? What is the difference between stubborn? And what is the difference between headstrong? Also in complete repertory it appears as obstinate headstrong. So after all, whatever you do, how does it matter? Isn't it? That is the question that one would have. But then you have other repertories which can be really small, precise. If you need to take that particular rubric, it will be so much easier for you to pick up that rubric from there instead of picking up a big broad rubric at times. Okay, so in this way we did complete. After doing the whole mentals, almost halfway through the complete repertory, what I found, friends, was that we were not able, and mind you, this is done with a whole inversion, in the sense each one is been given marks and then it was again converted via the computer program to find out what was the remedy outcome that I got through the repertory. Okay, supposing I said industrious is this and this, temperament this is this and this, then all the remedies that covered there automatically went into the choleric, the rest went into the melancholic. You get my point? Am I clear? And then what happened is, then I found out that okay, now what is arsenic? So it said okay, arsenic is, say, nervous, it is choleric, it is this. Okay, it gave me supposing 3 things like that. Then I would correlate with the materia medica and see whether the materia medica said the same thing as it would say, and unfortunately it did not. Okay, there was no the reason was that complete has got a lot of editions which have come on, the sources of which are very often not very clear because it's a very vast repertory. Even if it has appeared in some journal, it's there, but the source book doesn't talk about it at all. Okay, today if I ask you, describe to me a remedy, each one of you will be able to paint a different picture of a remedy altogether. Why? Because you have read it, you heard seminars, so and so doctor says case I have seen, this is like this and it was like this and therefore it was like that. Okay, everybody is right in their own way, but one needs to understand that finally source books are source books, and if you really want to understand the picture, which believe me, after this study of mine I am very clear is not difficult. Okay, then only then and only then you can really understand the true color of the remedy. Okay, if I were to ask you that you have to read Allen for the next time that we are going to meet, and this particular, would you read it? Tell me honestly, how many of you would really read it? I would say you to read Allen's and guiding symptoms, Herring's guiding symptoms, and come the next time for arsenic alb. You would read it? How many of you would read it? How many of you would actually be able to remember and understand it? How many of you would really understand it? And why would you not understand it?
It's very vast and it doesn't give a full picture. It's like too many details.
Too many details. Okay, so you get lost. So finally, practical usability of your materia medica comes down to 0, though it gives you everything. Okay, so we need to basically have very clear-cut pictures of remedies, and that you can only understand if you will be able to group from there and be able to understand what falls in which group, to be very clear of what you are prescribing. Okay, also it is not possible to open the Allen's, even if you have a comp in front of you. I don't think we would dare to open Allen's and read in front of the patient. Okay, the poor the patient would think it's your first day. So one would definitely not expect that. So as a result of which, if we've got to understand it, this was the